Hello, my name is Ryan Trochet. Today we'll be discussing and going over the Washington Township Community Paramedic Program for EMS 4320 EMS System and Design. The video is designed so that you watch this video in conjunction with the PowerPoint. I am not tech savvy enough to have lined it up so that you can see my screen as well. I will work on that. Moving on to slide 2. Why do we need a community paramedic program here at Washington Township? In 2024, Washington Township took over 10,247 calls of service, of which 7,826 were EMS calls. Breaking these down even further, 64% of those calls were EMS, and for geriatric patients older than 65 years old of age. The township as a whole has over 22,000 senior citizens living right here, as well as these residents range widely in living conditions, with some living in one of the nine nursing homes that we have in our jurisdiction, or living in assisted living communities. Some even living independently at the older age, and some senior living communities. Many of these senior citizens do not receive the proper assistance they need to effectively manage their health, and subsequently call 911 as a default option. The abuse of 911 for non-emergent calls in general costs the department money and wears down apparatus on unnecessary calls. If the department could preemptively help our senior citizens with non-emergent medical concerns and health concerns, it would significantly reduce our call volume. That decrease in calls would help save the department money and help reduce the wear and tear that our apparatus take going on those types of calls. There are plenty of benefits to the creation of a community paramedic program that we will continue to discuss. Slide 3, goal of the program. So to significantly cut down non-emergent call volume from our senior citizens, help the community get better and proper health care for basic needs. We can, for right now, we're limiting the program to senior citizens just because there is such a large abundance of them in our community to meet our specific community needs. But the goal is, if the program is a success, we can expand the criteria for those who meet the qualifications to get into the program. Another goal of the program is to be a spotlight for senior citizens who don't know where to turn for assistance. It can be very, very challenging and overwhelming for senior citizens to know where they need to go, who they need to speak to, and what they need to do to keep their health intact. And that can be challenging. And to basically help these senior citizens with basic medical needs, such as taking vitals, maintaining a healthy standard of living, medication administration, and adherence to prescriptions to making sure they stay healthy. Slide 4, planning. Washington Township plans to hire 2 full-time paramedics to work 40 hours, 0800 to 1600 Monday through Friday during the week to accommodate these senior citizens. These new members will be put through a 2-week orientation to cover specific nursing facilities, the senior living, neighborhood plats, hospital coordination, and other associated outreach programs that they'll be utilizing in the program. Planning, logistics. The 2 members will be assigned to the 2018 Freightliner Second Line Reserve Unused Medic. So currently Washington Township has 5 stations, 5 medic units on frontline duty with a reserve, and then at headquarters we currently have a reserve, because you never know what's going to go wrong. So we're going to be using that second line reserve until we get more medics situated in, and we'll constantly rotate out vehicles to make sure that we aren't relying on a inadequate vehicle. Continuing on, the members will work closely with on-duty crews, Kettering Health Network, Premier Health Network, Meals on Wheels, and all of the other associated nursing home facilities to accommodate applicants and recommended applicants of the program. The unit will be located at Washington Township Fire Department headquarters at Station 45 at 8328 McEwen Road, in a central location. That way it can better respond across the township in a timely manner. The unit will be filled with mandatory overtime as needed when assigned members of the 2 that we hire are off on sick leave, personal time, vacation. We'll fill it up when sent out overtime for it to keep that unit in service. Planning, operations. So the unit will be dispatched for low priority geriatric calls where transport is unlikely. On-duty crews can request this unit when appropriate. When appropriate, uh, they can then clear the call after the initial assessment or if canceled by the paramedic unit or the community paramedic unit. So we want to be very progressive and have it automized in our dispatch system for low priority calls for our specific qualifications and to make sure that those members meet our criteria. But we also want the crews to be proactive so that if they get there on scene and there's a lot going on, they can always just default it to the community paramedic unit so that way they can better handle that and keep that unit back in frontline service to accommodate the rest of the township. So the unit itself, the community paramedic unit itself, will be properly equipped and fitted to allow patient transport to a hospital if necessary. We're not stripping this thing and making it some weird conglomerate. We're going to keep it a medic unit. We're just going to add specific equipment that is better useful for these chronic health issues and our senior citizens that might not necessarily need transport, but we're going to remain the fundamentals of that medic unit so that it is still capable of patient transport if needed. This unit is, again, like I'm following up with, is specifically designed and meant for community paramedicine, but will be allotted as a last out medic. So before mutual aid is called, we will dispatch this unit. It will still have everything that it needs to take 911 ALS-based calls in an emergency setting. It will be no different from the outside as a regular medic unit, and it might just have it will have varied EMS equipment to better accommodate those chronic health issues that I was discussing earlier. But one of the perks and obligations that we're going to have to make to have this program properly funded through the township and get it greenlit is the capability and flexibility of this unit to be put in frontline service to avoid calling in mutual aid, cutting down en route times from other responding units, to making sure that our citizens, all of them, have access to a quick EMS response. This unit will also follow up with patients as needed and day-to-day assistance to avoid 911 activation. So when they're not being dispatched on calls, they'll be making rounds with scheduled appointments with the appointed and signed up members for this program. So they'll be following up to help them with their medication, to help them with all their needs. And if a call comes out low priority, they will then reschedule if needed. Come by, they'll stop by. They will work it out with that specific individual to make sure that they get full accommodation. Moving on to the next slide, proposal, application of the program and training. The department is proposing a competitive salary for the 2 full-time paramedics with a range of $68,000 to $80,000 top out with applicable insurance and benefits. We're doing this because we want good quality paramedics that can be trusted to take on this very, very new challenge of community paramedicine. We don't want people that don't want to be there, that just want to collect a paycheck. So we're trying to weed out people and get the best of the best. And the only way to do that is to offer a competitive wage. So the assigned medic unit for this project will utilize already available apparatus in the current ordering cycle. We do this by ordering medics and rotating them throughout the stations. That way we can properly replace them in a time or a realistic timetable and not overburden one or the other, because each station has its own call volume and that can vary, and we don't want the busiest medic unit to be absolutely destroyed for 4 years. So the requirements for these full-time paramedics is they will become ACLS certified, American Heart Association CPR certified, with an emphasis on home health classes and a preference for dual certification of paramedic nurses. Right now we will take what we can get, but the department later on with program success will look towards getting either these paramedics certified as nurses, or as more positions become available, we will look to try and get nurses as well, just to better fit the specific needs of this program. We will also be willing to pay with tuition assistance. Moving on to the next slide, proposal total costs. This is what everybody cares about. This is the part where we have to make sure that all of our T's are crossed and our I's are dotted to make sure that the money lines up. So personnel costs, roughly $180,000. We've done the salaries, we've done all of the information needed for our regular 2 full-time paramedics that are specified for this community paramedic program. We've also allotted some money to accommodate an expectation for the overtime that it's going to cost. So this isn't just the salaries of the 2. This takes into the 2 salaries plus I believe it was $20,000 or $30,000 of overtime that we are expecting to spend. That should be enough, but we just wanted to make sure that we are upfront with that, with the expectation that overtime is going to be used to fill this program so we can properly budget for it. Initial equipment purchasing. We're estimating that around $25,000, and that's just to restock the medic unit with 911 supplies, chronic health complaints, and equipment to better serve our program. Operation costs. This includes fuel, maintenance. We're expecting that to stay around $10,000 a year. A vested interest with the hospital networks and nursing facilities for some financial reimbursement where applicable. We're estimating that to be around $25,000. We're going to work closely with the hospital networks and the nursing facilities to get them patients, to get the senior citizens taken care of and properly seen by their physicians through those health networks and at the nursing homes to make sure that they are taken care of and squared away. And with doing that, we're bringing them business, and we're going to be working closely with them. And with that, there's a give and take, and us giving them that business and us helping them out in that sense. We're going to be asking for reimbursement within reason, which we've continuously been working with those communities and think that is, or those programs, and think that's feasible. As an initial cost, the creation of the program and implementation for the first year is a hefty $250,000. It's more expensive to just create the program and get it running. However, after all the major first initial purchases are made, it's going to drop down. So the expected annual operating costs moving past the first year, so after that initial $215,000, we're expecting it to drop down to about $170,000 to $190,000 budget after that. So it drops down significantly. With the 2025 Washington Township Fire Department budget, this would require the township to approve additional funding to avoid making cuts in other project areas. So we're essentially asking for an increase in budget from the township to accommodate this program. That way we aren't cutting any of our other programs and essential fire operation budget to accommodate this program. We don't want it to be seen as a burden to the fire chief. We want it to be seen as an extension and an addition, and not take away critical funding for other very important projects. Moving on to expectations. So out of the 7,826 EMS calls taken by Washington Township in 2024, like we said again, 64%, roughly 5,008, were geriatric patients, meaning 65 years of age and older. So the first year, we expect the community paramedic unit to take 750 calls, low priority calls, through dispatch, which would be just shy of 10.5% of our total our total department run volume from 2024. This would significantly reduce wear and tear on our frontline medic units. This doesn't account for the 911 programs not made because of this program. So in addition to the 750 calls that they're expecting the unit to be dispatched on, we're actually expecting to have a higher number of service calls just because they aren't calling 911. They're scheduling, they're following up, they're doing all these preemptive things so that 911 isn't activated and a frontline unit isn't mistakenly dispatched out for this low priority call for our geriatric patients. Through limited research though limited research suggests that community paramedic programs can be a cost saving to the healthcare system, primarily through fewer 911 calls and emergency department visits, reduced acute care utilization, reductions in hospitalizations and hospital readmissions, and with reduced health care costs associated with medically unnecessary ambulance transports, ED visits, and hospitalizations from the CDC. So what that quote is essentially saying is, it is a huge burden on the American healthcare system to have non-emergent 911 calls be taken to the emergency room, take up precious beds that those hospitals have. This program is in the best interest of the hospital networks, it's in the best interest of the community, and most specifically, it's in the best interest of those that qualify with a geriatric status with chronic health issues, because it gives them an outlet to use where they are not going to have an ambulance bill. They're not going to have to worry about navigating the very complex healthcare system. They're going to receive the care and the direction that they need to make sure that they properly manage their health. It works out for everybody. It's pretty rare, but sometimes in life we do find those programs that work best for all parties involved. Moving on. Evaluations. So how are we going to evaluate this program to make sure it's a success? A lot of that's going to be finance-based. So quarterly reviews for expenses to ensure budget compliance. All medic units are going to be tracked for call volume, patient demographics, total call volume, and percentage of non-emergency calls will be heavily researched to see any changes. So currently, we already manage all of our other medic frontline units and track these calls, but we're going to be adding the community paramedic and taking all of those data and all that statistics to see what percentage we're saving on call volume. Call volume and mileage will be taken from the community paramedic unit for data collection. Mileage on the frontline medic units is already tracked, but will be compared after 1 year of the program start to see the average mile usage comparison, see how much mileage we're actually saving on the medic units, if any, which we should significantly. This is done to accurately reflect wear and tear on the frontline apparatus that we can show to the township trustees and say, look, these medic units, very expensive. Right now, there's a long wait to get them, to order them, get them in, and actually in the bay door. If we can take mileage off 5 medic units in a significant capacity, we will greatly greatly expand the life of those vehicles, and that's going to save them significant money in the long run. So that's also a perk of this program. We will also be evaluating patient outcomes with referred medical assistance. We'll be tracking that for our data and our statistics to make sure that we get the program members taken care of and to the highest level of care. We'll be making sure that we do our job of getting them the higher level of care that they need to meet their specific day-to-day needs. We will also be tracking the time spent while helping patients with their day-to-day to better understand the community paramedic unit's time and account for non-emergency 911 activations that were not made because of the community paramedic unit. So we'll be tracking when they're doing scheduled visits. That way we can kind of count towards that with a metric to better understand. We can kind of predict how many calls we would be saving by the time that they've spent with those members. Moving on to the next slide, qualitative versus quantitative data. So the evaluation parameters focus on solid quantitative data with emphasis placed on cold, hard facts and statistics. With the brand new creation of this program, we must first justify its experience. That means bringing in the cold, hard facts and funding. This needs to be providing satisfactory numbers and percentages back to the success of the program. Later on, after the initial launch, a priority can be placed on obtaining qualitative data to help increase overall effectiveness. Right now, we just need to justify the creation and the maintenance of this, and the continuation, I should say, of this program. To do that, we have to show them the money, the cold hard facts, the mileage we're saving on our frontline apparatus, the lower call volume for the overall department, and the money that we're saving the township. Moving on to the next slide, the impact of a community paramedic. This is a quote that I saw and I really, really relate to from a local paramedic. When a serious health problem happens, you go to the hospital. However, some of the biggest challenges patients face happen after being treated and once they leave that emergency room. A lot of times when you get discharged from the emergency room, you're getting overwhelmed. Everything's being thrown at you, including new medications, new instructions, just everything. From Cheryl Wares with our ministry's community paramedicine program explains, elderly people especially will get home and question what just happened, what now? I could be that person to go out and talk them through that, help them understand why, what they need to do, and ultimately reduce those repeat emergency room visits. So the program right now, because we have a large geriatric population, this is a lot of them. They go to the emergency room, they're seen, they get discharged, they get some fancy paperwork that they might not necessarily completely understand. They get a 2-minute spiel from the very busy ER physician telling them what the next steps are. They might not always know the questions to ask. They might, for them, it is a bit overwhelming with all of the questions, the concerns, their health questions that they have. They don't know what to do next in a lot of the cases that we've been taking them to the hospital for. So they use 911 as a default because it'll get them seen by somebody. They don't know who, they don't know what they need, but they need to be seen. So this program is to give them a guiding light and walk them through exactly who they need to see, what they need to do, and how to maintain their health and not unknowingly or unintentionally overbear the 911 system with these types of calls. Next slide. So summarizing and bringing it all together now, senior citizens make up a significant portion of the township as well as a large portion of our specific patient demographics. We need to better serve them. This is all about them. The program's goal is to reduce 911 calls, reduce other medic units' wear and tear and call volume from these types of calls, free up resources, and most importantly, help our senior citizens navigate the complex healthcare system. This will be a very, very, very effective and productive project for the community. We owe it to our elders and community to make sure that they are not just medically treated, but taken care of as good people. That is what this exciting program is all about. We are here to save money, maximize department effectiveness, help the community, and the biggest one is to help our senior citizens and our elders and make sure that they can take care of themselves as long as they can, and when they can't, we are following up and making sure that their health is a #1 priority. And the last slide is just references. Thank you very much for listening. I hope it was bearable. I went a little bit long, so thank you very much for your time. I hope to hear more from you and any thoughts you might have had. Thank you.